Hey y'all, my name is Abby Terrell and I'm going to be talking about language assessments. I've actually gotten to observe a few language assessments in the clinic this semester, so that was very helpful in my making of this PowerPoint. One thing I do want to point out before I start is the difference between language assessments and speech assessments. Language assessments focus specifically on a child's or an individual's ability to communicate, like comprehend and receive and express language, while speech assessments strictly focus on the actual articulation of sounds. So I just wanted to preface that there is a difference. So what is a language assessment? A language assessment is performed by a speech-language pathologist to determine one's communication as well as their receptive and expressive language abilities. And it also tests cognition. Cognition leans more into that receptive language aspect. How is your brain functioning? How is it understanding written and spoken language? And then once the assessment is completed, the SOP uses the results to compare them to typically developing peers of the same age to see, okay, this is where this age should be, but where are they actually based on the results? So evaluation versus assessment, a lot of times there is evaluation before assessment when it comes to language. So I thought it was important to note the difference. So evaluation, defined by the American Speech and Hearing Association, is procedures used by qualified personnel to determine a child's initial and continuing eligibility. So basically, evaluation is done before the assessment. It is there to determine if an individual needs further intervention of therapy services. It addresses behavioral and cognitive concerns of those not meeting age criteria. So an example of this might be like a parent at home noticing their 2-year-old is not responding to questions or is not following directions, like more so than a 2-year-old wouldn't follow directions. Or maybe a teacher notices one of their students in class has very emotional outbursts or they have a hard time communicating with their peers. They might refer them to an SLP to do a further assessment. So then comes the assessment step, which is defined by ASHA, the ongoing procedures used by qualified personnel, the SLP, to identify the child's unique strengths and needs and early intervention services appropriate to meet those needs. So an assessment is a testing of specific areas of language, and it seeks to determine unique specific goals to target those language areas that the child might be lacking in, for lack of a better word. They're not typically developed in those certain language areas. So how is it done? Typically, language assessments are done through standardized language testing, and the SLP measures one score in comparison to the others of the same age. So there is other ways to technically do a language assessment, but the standardized testing is the most reliable way, and it's the only way that I observed in the clinic. And what it is, they all have their own specific language areas that they target, but it is basically there's a picture on one side that the child is seeing, and there's a question prompt on the other side of the book that the SLP is reading to the child, as you can see in this picture. And pictures are used as visuals, and they're prompts for questioning. After each prompt, the patient is either marked successful or unsuccessful, and the SLP looks to the specific test scorebook to add up the patient score based on how many successful or unsuccessful prompts they answered. And again, that numerical score is compared to others of the same age to determine a diagnosis and a goal. So I'll give a specific example of what this might look like. So a child is seeing the picture, and let's say the picture shows an adult and a child smiling and playing, like they're playing with toys together. The question prompt might be, tell me what's going on in this picture. And the goal is for the child to identify emotion, like, oh, the mom and the boy are happy, or oh, the mom and the boy are playing. It's just, again, testing that receptive language, like they're looking at something, how are they receiving that? And then again, how are they expressing that thought that they're seeing into spoken language to another person? So types of language assessments, I have 3 listed here. There's several more that I've noted at the bottom, but these are just 3 that I've observed like more than once in the clinic, so I'm familiar with it. There's the OWLS 2, the PLS 5, and the SELF 5. So the OWLS 2 is the Oral Written and Language Screener. This one measures cognitive skills. For example, to be more specific, it measures listening comprehension, negation, and negation is like showing you 3 or 2 different pictures and you say which one is not blank to identify like the odd one out. That's what negation is. Expressive language and understanding written language. So a downside or maybe limitation to the OWLS might be that this test is heavily based on comprehension. It doesn't really tackle other language aspects like receptive language or, expressive language or identifying emotions or identifying verbs, things like that. But this one, OWLS, is typically used for older children. So comprehension is more of a language difficulty for older children than like identifying things, but just a limitation that might be there. The PLS-5 is the preschool language screener. This measures early language in children, specifically preschoolers, and it specifically measures play skills, comprehension, emotions, and reading expressions. A limitation or downside is that it is heavily play-based and it might not score exactly where the child is language-wise. The resource that I read this from says that the results of this can be skewed sometimes because it's not a direct question and picture prompt exam like the OWLS of the SELF is. But since it is for very, very young children, being play-based can be helpful, especially when they have very short attention spans. So this one is good for children maybe 5 and under. And then lastly, the SELF-5. This measures core language skills in children, specifically sentence structure, comprehension, and following directions. A downside to this might be that it is heavily academic based and it might not capture daily communication skills. As you can see, like it does sentence structure, comprehension, following directions are very like grammar based things that one might be learning in school. So this can definitely help measure one's academic or like school setting success in language. But again, it might not tackle their emotions like negation, how they, story tell and use context clues for other things. But this one is good for older children who might be struggling academically. This was a good assessment to choose. And lastly, I just wanted to include some speech or articulation assessments that I've observed, just to show like what I've been watching in the clinic this semester. So 4 of them is the Arizona 4, the GTFA, which is the Goldman-Fristow articulation test. SSI is the stuttering, I think it's stuttering screener intervention. I'm not sure. And then the CAP2, these are all strictly articulation tests. They show a child a picture and the child says what the picture is. For example, let's say they show a picture of a cake and the child says it's a cake. And if they don't say cake, maybe they say take for fronting or K for final consonant deletion. This is specifically testing phonological processes. Again, not a language assessment, but just something I thought I'd include that I've observed this semester. And then these are the resources that I used. Thank you for watching, and I hope y'all have a good Thanksgiving.